What is spina bifida? Spina bifida is a congenital condition where the spine and spinal cord don't form properly during early fetal development. It is a type of neural tube defect, NTD, that occurs when the neural tube, which eventually becomes the baby's spinal cord, brain, and surrounding tissues, fails to close completely. This condition can lead to physical and neurological complications of varying severity. Types of spina bifida. Spina bifida is classified into three main types based on its severity. 1. Spina bifida occulta, the mildest form, often called hidden spina bifida. The spinal cord and nerves are typically unaffected. A small gap exists in one or more of the vertebrae, but there's no opening or sac on the back. May cause no symptoms or only mild signs like a small dimple, tuft of hair, or birthmark on the lower back. 2. Meningocele, a moderate form where a fluid-filled sac protrudes through the opening in the spine. The sac contains cerebrospinal fluid, but not the spinal cord or nerves. Neurological damage is usually minimal or absent, but surgery is often needed to repair the defect. 3. Myelomeningocele, the most severe form, where the spinal cord and nerves are exposed through an opening in the spine. This leads to significant neurological damage, including paralysis, bowel and bladder dysfunction, and other complications. Requires immediate surgical intervention to close the defect and protect the spinal cord. Causes and risk factors. The exact cause of spina bifida is unknown, but several factors may increase the risk. Folic acid deficiency during pregnancy, genetic predisposition, a family history of neural tube defects, maternal health conditions such as diabetes or obesity, certain medications such as anti-seizure drugs, which may interfere with folic acid metabolism, environmental factors like exposure to harmful substances during pregnancy. Symptoms. The symptoms of spina bifida vary depending on the type and severity. Spina bifida occulta, often asymptomatic or mild back issues. Meningocele, visible sac on the back, may cause mild neurological symptoms. Myelomeningocele, muscle weakness or paralysis below the defect, loss of sensation in the affected area, bladder and bowel incontinence, orthopedic problems such as clubfoot or scoliosis, hydrocephalus, excess cerebrospinal fluid in the brain. Diagnosis. Spina bifida is usually diagnosed during pregnancy through 1. Prenatal screening tests, blood tests like the alpha-fetoprotein AFP test, ultrasound imaging to detect abnormalities, amniocentesis to confirm the diagnosis. 2. Postnatal diagnosis. If not detected before birth, physical examinations and imaging tests like X-rays, MRI, or CT scans can identify spina bifida. Treatment. Treatment depends on the severity of the condition. Surgery. For meningocele or myelomeningocele, surgery may be performed shortly after birth or even prenatally to close the defect and prevent infection. Therapies and interventions. Physical therapy to improve mobility and strength. Occupational therapy to assist with daily activities. Assistive devices like braces, wheelchairs, or walkers. Managing complications. Treatment for hydrocephalus, e.g. shunt placement. Bladder and bowel management programs. Prevention. Folic acid supplementation. Women of childbearing age should take 400 to 800 micrograms of folic acid daily before and during early pregnancy. Healthy lifestyle. Maintain a healthy weight. Manage chronic health conditions. Avoid harmful substances like alcohol and tobacco during pregnancy. Prognosis. The outlook for individuals with spina bifida varies based on its severity. Early intervention, multidisciplinary care, and advances in medical treatments have significantly improved the quality of life for many affected individuals. Would you like information on living with spina bifida or specific treatment options?